All right, good morning and welcome to a special media briefing on hantavirus hosted by the College of American Pathologists. I'm Charles Fiegel, Interim Senior Director for Strategic Communications and Periodicals. We will begin with brief remarks from our experts, and then we will take your questions. To ask a question, please raise your hand or type them into the chat. We'll try and get to as many questions as possible in our limited time today. It is now my pleasure to introduce our president, Dr. Chiwe Jim Jai.
Good morning and welcome to our media briefing on the hantavirus outbreak. I am Dr. Jim Jai, president of the College of American Pathologists. Over the next 30 minutes, our panel of experts will answer your questions about hantavirus, including how it spreads, how it is diagnosed, and what clinicians and the public should know. Hantavirus can cause severe illness and in some cases be life-threatening. Early recognition and diagnosis are critical to improving patient outcomes. Joining us today is Dr. Mara Hunter Broadhurst, a member of the CEP Microbiology Committee and an associate professor in the University of Nebraska Medical Center's Department of Pathology, Microbiology, and Immunology. We are also joined by Dr. Bobby Prate, professor and laboratory medicine and pathology and the chair of the Division of Clinical Microbiology at the Mayo Clinic. After brief opening remarks from our panelists, we will take your questions. Please raise your hand and wait to be recognized, or submit your question in the chat. Dr. Broadhurst, we will start with you.
Thank you, and good morning, everyone. If I could ask for some clarification on the scope of initial comments, please.
Just some brief introductory remarks, Dr. Broadhurst. Yeah.
Okay, great, thank you. Well, what we have here is a scenario of an outbreak of the Andes hantavirus. This is an endemic virus to South America that has affected a group of individuals on a cruise ship. This is an unprecedented scenario, so we are responding as we can with the evidence that's available. But we do know that that this virus is able to be transmitted between people. Andes hantavirus is unusual in this way, and that has led to additional precautions in ensuring that, one, we're taking care of individuals who may be exposed to the virus, and two, that we are taking steps to protect our healthcare workers as well as the public from any further spread of the virus. Thank you.
Go ahead, Dr. Pritt.
Okay, well, good morning and welcome, everyone. Thank you for joining us today. I'm sure all of you have heard a lot about hantavirus and the Andes strain. I think that one of the big questions that comes up is how much of a threat is this to the public? I would say that we should definitely respect this virus and not trivialize it, but also not catastrophize it. We've certainly seen other outbreaks and even the COVID pandemic, and we know that it's not that setting. We have no evidence of sustained community transmission outside of close contact settings, no evidence of efficient airborne spread in public spaces, and no recommendation for general travel restrictions. And in my mind, two of the big things that have come out of this so far is that, first of all, the importance of public health in contact tracing, quarantining exposed individuals, isolating those with symptoms. And then also, as a pathologist, I want to emphasize the importance of laboratory testing, not just serologic testing, which is the detection of IgM and IgG antibodies which is considered the gold standard method, but also our advanced techniques like PCR and next generation sequencing, which allowed us in this case to very quickly identify the cause of this outbreak, and that's the Andes virus or Andes strain, and also is allowing us to look at the strains from infected individuals so we can see that they are related. And therefore, I think that we can't emphasize enough the importance of pathologists and laboratory medicine in effectively managing this outbreak. So with that, I'd like to open it up to questions, turn it back to Dr. Zhai if he has any other remarks.
Sorry, Dr. Zhai, you're on mute.
Sorry, I think we're ready for the questions. Right?
Okay. The first question we received pre-submitted was from Julie Steinhausen from Reuters. Many people have been responding to the hantavirus outbreak on the cruise ship through the lens of a global pandemic that impacted all of us. Can you please address the concerns people have about the virus and the risk relative to the actual risk? We're trying to thread the needle between the fact that those infected or directly exposed, this is a very scary disease, but for the vast majority of us, this is not a risk.
I can start by that, and then I'll turn it over to Dr. Broadhurst. Just reiterating the points that I had mentioned, people definitely are concerned. And for those that have had close contact to infected individuals, they have a right to be concerned. We definitely want to respect this virus with an up to 40% case fatality rate. Those that are truly exposed are at that heightened risk. We don't want to trivialize it, but we also don't want to catastrophize it. This is not a pandemic setting where we have a high transmission rate person to person. We know it really takes prolonged close contact to transmit this virus. And so we want to really emphasize the main points that outside of these close contact settings, we're not seeing the sustained community transmission that would concern us. I'll turn it to Dr. Broadhurst, and then we also have Dr. Ben Bradley, who's a virologist and member of the microbiology committee, and they can add, I'm sure, much more.
Thank you for those comments. I will add that an important difference with this outbreak is that this virus is an endemic virus to South America that has been studied for decades. So there is more information at the outset that helps us to understand how this virus is transmitted and what these risks are than what we had at the start of the COVID-19 pandemic. So I want to emphasize that we do have more information that is guiding the risk assessment and how this is being approached. And as Dr. Pritt said, this is not a virus that is transmitted easily or through casual interaction, as we have found with viruses like influenza and SARS-CoV-2.
I'd just like to echo that as well. Thank you for the introduction, Dr. Pritt, Dr. Bradley, pathologist at University of Utah and medical director at ARUP Laboratories. I think something else that's kind of interesting about this case is it did occur on a cruise ship. And if you look back in the literature of infectious diseases, cruise ships have been a nidus of a few outbreaks where we've been able to get a sense of the R naught value, or how many people are at risk from being infected from a single individual. Noroviruses, what we all get taught about in medical school, where those things can have an incredibly high incidence on cruise ships of a virus that causes a gastrointestinal illness. But even early during the COVID pandemic, these cruise ships actually gave us some good data about the R naught value of COVID as well. And to echo Dr. Broadhurst and Dr. Pritt here, we're just not seeing that high transmissibility between humans on this cruise ship that would make us think a pandemic or an epidemic is going to happen from this outbreak. This was really kind of a singular event here that certainly warrants study and better understanding, but we're not seeing the beginnings of a pandemic here.
Thank you. Jacob Lawson asks, With quarantine individuals not being mandated to stay in the quarantine facility, how do we assure the public those individuals won't spread the disease when and if they leave? Is the virus contagious when not symptomatic?
I'm happy to make some first remarks there. We do not have evidence of transmission of this virus in asymptomatic people. We do know that it's appropriate to take precautions in individuals who have had an exposure who may develop symptoms. So for those individuals who are either under monitored quarantine in quarantine facilities or those who are under monitoring and quarantining at home, there has been an understanding that the most important thing is that people are aware that symptoms can develop within a pretty long incubation period. So one aspect of the biology of this strain of hantavirus, again, that we know from prior work and prior outbreaks, is that the incubation period can be as long as 6 weeks. And what that means is that the time from exposure to developing symptoms can be as long as 6 weeks. And if symptoms develop, as has been noted, this is a very serious infection, and those symptoms can escalate quickly, and it's very important that people have access to higher levels of care. And so I want to emphasize that every individual who has had an exposure to this virus is very well aware that that symptom monitoring is very important. And that being able to access appropriate care with the appropriate infection prevention and control precautions is very important.
Okay, a question submitted before our briefing from Faye Fox with ABC 3340. What everyday situations, such as older homes, construction sites, or rural urban edge areas, could realistically put someone at risk for hantavirus? And how common is that risk compared to what people may be seeing in the national headlines?
I can start this since I own a cabin myself and certainly see rodents from time to time. First, it's important to mention, as Dr. Broadhurst mentioned, that the Andes strain of the hantavirus is found in Argentina and Chile and South America. It's not found in North America. So we wouldn't be talking about this specific strain of the hantavirus if you're in the United States. And you're worried about rodents and contaminated areas. But we do have other hantaviruses in the United States. The Sonoma virus in the Four Corners region, of course, is an important one, but we have them in other states as well. And so really the concern is that rodents, especially in enclosed places that have been abandoned or are not being used, rodents can build their nests. And of course, we know that hantavirus is transmitted through contact with urine, with feces, saliva, potentially even bites from a rodent. And so those would be areas of potential concern. If someone were to be cleaning around their house and they come across an area where rodents have built nests, where there's rodent droppings, where it looks like there may be rodent infestations, then there are some things that we would want to do, that they would want certain precautions to take, such as cleaning the area. There's guidelines put forth by the WHO and CDC for wearing appropriate respiratory protection, perhaps an N95 mask, a respirator, goggles, wearing gloves, using a bleach solution. But those would be the rare settings. That wouldn't necessarily be a setting that most people would be worried about unless they have that environment where there could be a large quantity of rodent droppings, for example.
Thank you. Fred Knapp with Nebraska Public Media asks, Why do you think people are catastrophizing this?
Yeah.
And
Yes, I had used that term, and I mentioned it only as a caution that we want to take this virus seriously for those that have had true exposures. And of course, we're quarantining, isolating people that have symptoms, but we don't want people to think that this is a risk to the general public in open spaces. And therefore, the type of responsible media and reporting and the really good scientific research that we're discussing here today is so important, because we also know that a lot of people get their news these days from social media, where not everything is responsibly reported. And when you hear something like a 40% case fatality rate, people obviously get concerned. So I'm so glad we're doing this today to get legitimate and responsible information out to the public.
right, and Deidre McPhillips from CNN asks, for the patients being monitored, do you recommend regular routine testing for everyone, or is that only necessary when symptoms appear?
I'll respond generally to say that testing is an individualized decision between the clinicians and the individual who's had an exposure.
I think the only thing I'll add to that as far as testing goes is, this is not something that, if you saw a mouse in your house yesterday, you should go to your provider and ask for hantavirus testing. This is really a very specialized test that's available mostly through state and local public health labs. It's something you would want to talk with your provider about before getting that testing done. The other thing is the test that we use for this serology. Because of how many different strains of hantavirus also exist, there can be sometimes risk of cross-reactivity or false positive tests. And so if we're testing people who already have a very low positive or no chance of having the disease, then if we do see a positive result from a test like that, we know it's a false result. We don't want people to experience any more anxiety about this than they need to. So also understanding kind of who's appropriate to be testing here. And really it's for these patients where we have clear epidemiological links to cases right now.
And just a quick follow-up from Shauna Elbert from CAP Today. What is the CDC's and state local public health laboratories' ability to test for and sequence this strain of the hantavirus or others? Should clinical laboratories be contributing to this testing effort?
I can chime in on that, and then I'm sure others will have some comments as well. There is limited testing, mostly at specialized reference laboratories, state and public health laboratories, the CDC in the United States. I work for a reference laboratory, Mayo Clinic Laboratories. We do have a hantavirus serology test that we are working on making public so that people could use it through a physician's order. But the testing is not readily available outside of those referral settings. Thankfully, though, it meets the needs at this time. And when we get into the more specialized testing like next generation sequencing, those would also be more restricted towards a public health setting. Dr. Bradley and Dr. Broadhurst, I believe you also offer testing at your facilities.
Yeah, I'll add that as with many viral infections, both serology and PCR-based detection are in play for diagnosis of this disease. Serology, as has been commented on, is what is most available, and that is the test that is offered by the CDC. So detection of IgM, which is an early indicator of immune response to the virus, and is sensitive for diagnosing the infection once symptoms have developed, is the test that's utilized by the CDC and has been made available in select reference laboratories, as Dr. Pritt mentioned. PCR-based testing is also a tool in the toolkit for diagnostic testing for this virus, and is being developed by a couple of laboratories who are engaged in close monitoring and care of exposed individuals. I will note, again, as Dr. Pritt mentioned, we do have an endemic hantavirus here in North America, sin nombre virus. And so some laboratory testing tools have been developed to diagnose sin nombre hantavirus. And there are some similarities between these viruses that allow for some utilization of these tools that can detect both sin nombre and Andes virus infection. So there is some pre-existing capacity and laboratory tools available.
Okay, thank you. And I'll just remind those in attendance, you can raise your hand and ask the question yourself. I'm happy to read them aloud, but that's also an option if you wanted to ask a question directly. I'll follow up here with this submitted question from Deidre Phillips, CNN. We've heard reports of a mildly, quote unquote, mildly positive test in one of the American passengers. What does this mean?
Some limited testing was performed prior to these Americans being repatriated for additional care. So that testing was performed outside of the US, and there's very limited information about that testing.
Thank you. And Patrick Martin from NBC New York, can you give more clarity on the quarantine measures? How long do you expect the passengers to be in quarantine? Should they be in quarantine for the full 42 days like other countries are doing?
So I'll start off on that question. So here in Omaha, Nebraska is the National Quarantine Unit. This is a federally designated facility that is intended to allow us to monitor and take care of people who have had exposure to high consequence pathogens. So this is an intended use of the facilities that we have here, and for the very specialized teams that we have to take the best care of people who are exposed or who become sick. The duration of quarantine, those recommendations are based on what we understand about the incubation period, so the time between exposure and developing symptoms. The use of the facilities here in Omaha will be available for that duration of the incubation period, but decisions around how best to strike a balance between monitoring in these facilities and monitoring at home is something that is an ongoing conversation.
Charles, you're muted.
Sorry, thank you. Jacob Lawson asks, are we concerned for mutations coming from this?
I wonder if Dr. Bradley would want to comment on that. Dr. Bradley, as a virologist who studies RNA viruses.
Yeah, I haven't really seen the sequences for this yet, so I'm probably not qualified to comment on that exactly, but something Dr. Pritt raised earlier that's really been a huge advantage to us is the access to next generation sequencing so that we are able to genotype these viruses in near real time and share that public health data. So to my knowledge, I'm not aware of any of these mutations, but I certainly think that's being studied. We do have models for examining this as well. So I think that's something that will be coming out in the scientific literature in the future as well. So I think that's something we need to stay tuned for. Certainly when you see events like this, it does raise that question in your mind. Is there something unique that's happened here? But also certainly the environment of a cruise ship is kind of unique to itself as well.
And there certainly have been outbreaks of this in Argentina, for example, in the past with much larger numbers. And I guess it's reassuring, although certainly possible that a mutation can occur. It's reassuring that we didn't see that in previous outbreaks. I don't know, Dr. Broadhurst, if you wanted to comment.
I'll only add that the evidence we have so far from the sequence that has been made publicly available suggests that this strain of the virus is similar, very similar to those that have been sequenced in South America previously, which is reassuring that we can take lessons learned from prior infections and outbreaks in Argentina and Chile and extend those lessons into this current outbreak.
Thank you. I believe that all the questions that have been submitted have been answered. I'll just pause for a moment to see if anyone wants to raise their hand and ask a question live.
Charles, there was one question earlier about how the virus could have gotten onto the cruise ship. And it's my understanding from the public health epidemiologic investigation that's occurred is that the thought is that these the two individuals, the first case and then the close contact, probably were exposed while in Argentina. They had been traveling for months in Argentina. So that's probably the people that brought it onto the cruise ship. Of course, we can't confirm that at this point.
Thank you. Dieter McPhillips from CNN. WHO is reporting 11 cases, 9 confirmed. Do we know how many of those were confirmed with PCR versus serology?
I do not have that information, but because we do know that PCR or sequencing is available, I'm assuming that that would be the confirmation that would be desired, which may take some time to have that completed, but that would be the definitive identification. Since, as Dr. Broadhurst mentioned, or Dr. Bradley, the serology, there is some cross-reactivity between closely related hantaviruses. But when you do a case investigation and you have someone who was potentially exposed to an infected individual, and then you have a positive result, be it serology or molecular testing, that would be enough for at least a presumptive case diagnosis with then confirmation by definitive testing.
Okay, thank you. I believe that's probably our last question. Any final thoughts from our panelists?
I'd like to thank everyone for joining us today and for doing the responsible reporting of getting this information out to the general public.
And thank you. Dr. Zhai, can you please close us out?
Yes, I want to say thank you as well. Thank you, the expert. Thank you, everybody on the screen, for your thoughtful questions and answers today. If you have any follow-up inquiries, please reach out to our media relationship team at media@cap.org. We appreciate your time and attention to this important public health issue. Thank you again and have a good day.